Hello, my name is Dr. Patrick Reeves, and I'm a pediatric gastroenterologist at the Children's Center at Walter Reed National Military Medical Center. When patients, adolescents, and young adults are being treated for cancer, they can experience severe nausea, the feeling of sickness or discomfort that we associate with the need to vomit. Today, we will discuss nausea and vomiting that can be attributed to the anti-neoplastic and chemotherapy that children and young adults receive who are undergoing cancer treatment. We will further discuss how to use the Uniformed Services Chemotherapy-Induced Nausea and Vomiting Action Plan to recognize and treat these symptoms at home. This video is meant to educate patients, adolescents, and young adults undergoing chemotherapy, as well as their families, about nausea and vomiting management at home. Nausea is an unpleasant feeling that can involve sweating, chills, dizziness, and difficulty swallowing. Nausea is one of the most common complaints from patients undergoing chemotherapy. If not well managed, chemotherapy-induced nausea can lead to vomiting or worse, poor nutrition, weight loss, and other health complications during the cancer treatment course. Nausea can be caused by the cancer itself, the chemotherapy, the radiation, or a combination of these factors during the treatment course. Oftentimes, the cause of the nausea itself cannot be avoided. Luckily, there are many pathways with which to deal and treat nausea and vomiting related to chemotherapy. One of the best ways to manage these patient problems at home is by eating a healthy diet. This diet should involve eating small snacks and meals, eating and drinking slowly, eating bland foods such as crackers and toast when the patient has nausea, avoiding spicy, acidic, or greasy foods, especially during episodes of vomiting, and eating in locations that don't have other strong smells like cigarette smoke. Other effective lifestyle changes that can help manage the patient's nausea include regular exercise, using coping strategies such as diaphragmatic breathing or distraction, and using other supportive techniques like acupressure, aromatherapy, or even hypnosis. For many patients, the nausea they experience throughout their treatment for cancer requires the use of medicines. You and your oncology team will work together to decide which set of medications will work best for you. Please keep in mind that every patient is different in how they respond to the chemotherapy medicines and what other drugs need to be taken to help control nausea and vomiting related to chemotherapy. The management of chemotherapy-induced nausea and vomiting is very complex, and some medications that your patient uses during their chemotherapy protocol may prevent them from using other specific anti-nausea medications. Rest assured, your oncology team and other group of experts will help to identify which medications work best. Your job is to continue to work closely with your oncology team to make the most effective plan for you so that we can personalize our approach to your healing pathway. Without further ado, let's talk about the Uniformed Services Chemotherapy-Induced Nausea and Vomiting Action Plan. This action plan starts with identifying information at the top, which provides you and your clinical team with useful contact information. Below that are 3 treatment sections divided based on the severity of the patient's nausea or vomiting. The pictures and words are meant to guide you in recognizing these symptoms. After recognizing the symptoms in a specific colored section, the plan tells you what medications should be taken or given to the patient. The first section is the green zone. Here we discuss prevention of nausea and vomiting related to chemotherapy. The goal for every patient is to have no nausea or vomiting at all, but sometimes this cannot be avoided. The patient is in the green zone if they can still eat and drink well, have no vomiting, and complete their daily life activities with little distraction or resistance. In this zone, you can see scheduled medicines that your oncology team has prescribed to help prevent nausea and vomiting. In some patients, there may be no medications in this column, as some patients do not experience chemotherapy-related nausea and vomiting at all, and thus only need treatment when the symptoms arise. However, many patients have high levels of nausea risk related to their chemotherapy and will need to have medications available and scheduled in this preventative section. You will see a column for scheduled medicines, how much to take, how often to take them, and other special instructions that your clinical team wants to make you aware of. If the nausea or vomiting worsens, your patient may tell you that they feel nauseous or are having vomiting. Sometimes, given how complex this condition can be, they may complain of other problems, which could include eating or drinking less, being less active or interacting less, or having one episode of vomiting, or even some dry retching. These symptoms describe being in the breakthrough or yellow zone of the plan. Of note, oftentimes prescriptions for these medications are given to the patient with one label from the pharmacy. This plan may use the same medicines from the green zone when you are in the yellow zone, but rest assured the plan will guide you if the doses in the yellow zone are going to be higher. It will be important to read the action plan carefully as you proceed. Go through the different scenarios with your oncology team before leaving your appointment in order to know how to use the plan best. In rare cases, the nausea and vomiting may be getting worse in this patient related to their ongoing chemotherapy. Sometimes the yellow zone breakthrough medicines are not enough to control the patient's nausea or vomiting. If these symptoms continue for 1 or 2 days, the patient may find themselves in the red zone. The patient's nausea may be bad enough they have more episodes of emesis, more retching, more nausea, or they are unable to eat or drink. This means that the patient is uncontrolled from a chemotherapy-induced nausea and vomiting perspective and needs to follow the red zone, which will always include notifying your oncology team for next steps. In rare cases, nausea and vomiting can be early signs of a bigger problem. Sometimes this can be so severe that there is no longer time to try other medications or therapies. When this happens, this patient has an emergency and your oncology team needs to be notified, and we typically recommend you go to the emergency department. These symptoms include dehydration, intense belly pain, or a fever, which is a temperature of 100.4 Fahrenheit degrees or greater. If any of these symptoms occur, again, you should proceed to the emergency department and call your oncology team emergency line immediately. Now we will do a teach-back session to check on your learning. The teach-back session is comprised of 3 scenarios using this example action plan to see if you, the parent or caregiver, know what the next correct step is. Don't worry, we will give you the answers as we go along. For our first scenario, we have Don, who has started therapy for leukemia and has been given this action plan to help manage his nausea and vomiting. You can see that Dr. Penny has completed the action plan completely with all of Don's demographics, including his name, his date of birth, the date that the plan was updated, his record number, his weight, and his height. You can see that the patient's body surface area is automatically calculated on the plan, and that Dr. Penny has highlighted the patient's nausea risk and entered the chemotherapy protocol for which Don is receiving for his treatment for cancer. Now, let's go through some scenarios. If Don is eating well, drinking normally, and is not having any vomiting, which zone would this correspond to? Would it be the green zone, the yellow zone, or the red zone? That's right, Don would fall into the green zone because he is doing very well. You'll notice that for Don, he needs to take Zofran every 12 hours and a Prepotent in different doses and at different times during his chemotherapy, as written by Dr. Penny, the oncologist. This dosing and frequency may be different for your patient, even if they are the same age or weight as Don, so make sure to consult your plan and your oncologist specifically. Now, let's think about what would happen if Don has continued taking his Zofran every 12 hours and that it is currently 2 days after his chemotherapy. He has already taken his 80 milligrams of a Prepotent today, as discussed in the green zone medicines. Unfortunately, even though Don has been taking his medications, he starts eating less, drinking less, being less active, and even has a small vomit. When asked if he is nauseous, he says, "I don't know, I just don't feel well." What zone does this place Don into? That's right, Don is in the yellow zone. Even though he has been taking his medicines from the green zone, he needs to use his rescue therapies in order to help reduce the symptoms he is having related to nausea and vomiting. Now that Don is in the yellow zone, will he stop taking his green zone medicines and take these instead? That's right, he will not stop taking the green zone medicines, but will rather add his rescue medicines from the yellow zone to the green zone plan. So he should continue taking both the green zone and the yellow zone medicines as a part of his chemotherapy-induced nausea and vomiting action plan. Finally, let's say that Don has tried these steps and now is having multiple episodes of emesis, that he is having severe retching, and he cannot eat or drink at all after 24 hours. What zone does this place Don into? That's right, Don is in the red zone, which is the uncontrolled phase of chemotherapy-induced nausea and vomiting. His plan directs him to call his oncology team immediately. We hope that this teach-back session has been helpful to you. Remember to work closely with your oncology team on your patient's specific action plan, as it can vary significantly between patients and even may change for the same patient as their chemotherapy protocol progresses. For many patients, this is a constantly changing regimen. For any further questions, speak with your oncology team. Thank you.